airway management, it comprises of, first, what does airway management comprise? It comprises of face mask ventilation. You must be able to ventilate a patient using bag mask or face mask ventilation. Second, laryngoscopy and tracheal intubation. These are the four basic pillars in managing any airway. Face mask or bag mask ventilation. Second, laryngoscopy and tracheal intubation or endotracheal intubation. Tracheal, laryngoscopy and tracheal intubation. Airway management comprises of four pillars. First is bag mask ventilation of the patient. Second is laryngoscopy and tracheal intubation of the patient. Third is securing the airway with supraglottic airway devices. The securing of the airway with supraglottic airway devices or with LMAs. In cases of unanticipated difficult airway algorithm, you must know how to secure an airway with supraglottic airway devices or LMAs. Now the fourth one is securing the airway with surgical access. By surgical access, you have to secure the airway either by tracheostomy or laryngotracheostomy. The securing of the airway by tracheostomy is surgical access. Now, airway management has got basic four pillars. One is face mask ventilation. Second is laryngoscopy and tracheal intubation. Third is securing of the airway using supraglottic airway devices or LMAs. The fourth is securing of the airway using surgical access, that is by tracheostomy. So, the basic features which constitute of airway management will deal one by one. First, coming to the bag mask or face mask ventilation. Now, what are the predictors which may constitute a difficult bag mask ventilation, where there are different group indices? There are different group indices which might constitute to the difficult face mask or bag mask ventilation of the patient. Now, what are they? There is a mnemonic by the name of bones. When these are the predictors, when you can see in a patient, you can consider that this might be a patient in whom face mask ventilation will be difficult. Now, what is it? A bearded person. B stands for beard. Bearded person is gonna be a difficult person, anticipated difficult person for face mask ventilation. A person having beard is gonna be difficult for face mask ventilation. O. O stands for obesity. O stands for obesity. A person with a BMI of more than 26 kg per meter square. A person having BMI of more than 26 kg per meter square, obese patient, is considered as difficult for face mask or bag mask ventilation. N stands for no teeth. A edentulous patient is always going to be a difficult patient for face mask ventilation. In elderly patients are generally cachexic. They have got like indrawing of cheeks and all, so that there is a lot of leak, and they have got like edentulous with malformations of teeth and all. So elderly patients are going to be a patient for difficult face mask or bag mask ventilation. Next, we will come to the S, that is snorer. A person who snores during sleep or obstructive sleep apnea, the person who snores is a patient who will be difficult for face mask ventilation. So, in cases of airway management, there are basic pillars, 4 pillars which we have dealt with. Of that, first one is difficult predicting face mask ventilation. Second was laryngoscopy and tracheal intubation. Third one was securing the airway with supraglottic airway devices. And the last one was securing the airway with invasive access, that is like with tracheostomy. So, the first predictor, which is like face mask ventilation in cases of airway management. How do we predict difficulty in face mask ventilation? Is by a group of indices, which consist of, the mnemonic is bones. If the person is having beard, it is going to be a difficult face mask ventilation. These are the questions which have been frequently asked in the entrance examinations, like which of the following predictors will be there for a patient which will be difficult for face mask ventilation. Which of the following is not a predictor of difficult face mask ventilation? They will give you bearded person, obese person, or BMI of 30 kg meters per meter square, age-endless person, or a person who's around 20 years or 30 years of age. So these are the predictors, and there you may add in this, like there is difficult or distorted anatomy, or there are loose teeth, or large upper and lower incisors, large upper and lower teeth, or small jaw, in which there will be retraction, will be difficult. Micrognathia. These are the persons in which face mask ventilation is going to be difficult. B stands for bearded person. O stands for obese, in which BMI is more than 26 kg per meter square. N stands for no teeth. E stands for elderly patients. S stands for snorer. In snorers, what happens? The tongue generally falls on the pharynx, so they snore, or there is like less space in the airway in cases of micrognathia, or in cases of obese patients. The airway or face mask ventilation is going to be difficult. Now, coming to the second part of the airway management, which constitutes of laryngoscopy and tracheal intubation. Now, how will you determine the predictors of laryngoscopy and tracheal intubation? The various physical indices which help us in assessing the difficulty in laryngoscopy and tracheal intubation are the movement at atlanto-occipital joint, which is like extension of the neck. Neck extension. If the extension of the neck is less, if there is not much of an extension of the neck, what we do in this test, we ask the patient to look up to the ceiling without raising of the eyebrows or without frowning. We ask the patient to look up to the screen, or we put a left finger at the mental point and the right index finger at the occiput, and we ask the patient to look up to the ceiling. Once the patient looks up to the ceiling, the left incisor goes above the right index finger. That means the extension of the neck is good. If the neck extension is not good, that is an predicted indicator of difficult laryngoscopy or difficult intubation. If the neck extension is not good, it's going to be a difficult laryngoscopy or difficult intubation, tracheal intubation. This is extension of neck or at atlanto-occipital joint. The second one is temporo-mandibular joint and mouth opening. The extension at temporo-mandibular joint or mouth opening of less than 3 fingers. Less than 3 fingers. Inter-incisor distance of less than 3 fingers is going to be a predictor of difficult intubation for difficult airway for laryngoscopy and tracheal intubation. Now, coming to the next point, which are the distances. One is the thyromental distance, that is from the thyroid cartilage up to the mental part. Thyromental distance. The thyromental distance should ideally be more than 6.5 centimeters, but if it is less than 6 centimeters, it is a predictor of difficult airway, of difficult laryngoscopy and tracheal intubation. The next is hyomental distance. Hyomental distance should normally be more than 6 centimeters, but if it is less than 4 centimeters, there are different grades, grade 1, 2 and 3. Ideally grade 1 should be more than 6 centimeters, but if it is less than 4 centimeters, it's going to be a difficult airway. which is going to be causing difficult laryngoscopy and difficulty in tracheal intubation. Next is sternomental distance. Sternomental distance is normally more than 12.5 centimeters. Sternomental distance is normally more than 12.5 centimeters. Less than 12.5 centimeters is a predictor of difficult airway. So what happens in cases when you predict, when you assess the airway for the second pillar, which is like laryngoscopy and tracheal intubation, after you have mask ventilated the patient, when it comes to actually instrumentation and handling of airway, these are the various predictors which will give you a certain idea about the difficulty that you may encounter or predicting of the difficult airway in cases of laryngoscopy and tracheal intubation. Which are they? The neck extension at the atlanto-occipital joint. The neck extension, if it is not good, if it is restricted, which might be because of various causes like spondylosis, because of diabetes long-standing, then it is a predictor of difficult intubation. Temporomandibular joint and mouth opening. Temporomandibular joint extension, opening of TMJ, and mouth opening, if it is less than 3 fingers, it is a predictor of difficult laryngoscopy and intubation. Thyromental distance. Thyromental distance normally should be more than 6.5 centimeters. This has been asked in the recent examination. Most important. Thyromental distance, hyomental distance, sternomental distance. These three has to be learned because this is very confusing. One is like 6, 6.5, around 12, 12.5. So the thyromental distance from the thyroid cartilage up to the mental part, the thyromental distance has to be more than 6.5 centimeters. If it is less than 6.5 centimeters or less than 6 centimeters, which is a Patil test, it is a predictor of difficult airway. Then next comes hyomental distance, the hyoid bone up to mental. Hyoid bone up to mental. Hyomental distance has to be more than 6 centimeters, which is grade 1. If it is less than 4 centimeters, which comes under grade 3, it is a predictor of difficult airway. Then sternomental distance. The sternomental distance, these all distances are counted with the neck extended in sniffing position. The sternomental distance has to be more than 12.5 centimeters, which is normal. If it is less than 12.5 centimeters, it is considered a difficult airway predictor. The airway is considered to be difficult. The neck circumference, short neck or the neck circumference of more than 40 centimeters is a predictor of difficult airway, difficult laryngoscopy and difficult tracheal intubation. Mouth opening of less than 3 fingers is a difficult airway predictor.